My name's Jon Dorling. I'm a neonatologist from Nottingham and I'm the Chief Investigator for the SIFT trial. So the SIFT trial is being run by the National Parental Epidemiology Unit in Oxford. The aim of this podcast is to give you an overview and a bit more understanding of the SIFT trial. Okay, the reason we need to do the SIFT trial is essentially we really don't know how quickly we should increase the milk feeds for our preterm babies, and we need to examine that and assess the benefits. Current evidence about when to feed or how fast to feed the babies is summarised in a Cochrane review by Morgan, Young and Maguire, and that was updated in December of 2012, so it's reasonably recent. And there were, I think, 580 or so babies that have been studied in 5 trials that have looked at similar rates to ours. And that gives us some indications that there might be some benefits in terms of mortality, in terms of reduced infection and reduced necrotizing enterocolitis. The hypothesis in the SIFT trial is that one group or other of the babies either being fed faster or slower will do better in the long run. So primarily that's based on whether they'll do better with their neurodevelopment. So will they have severe or moderate disability, or will they be fine when they're assessed at 2 years of age? There are other outcomes as well that we'll be looking at, but that's the primary hypothesis. The secondary outcomes for the SIFT trial are the incidence of microbiologically confirmed or clinically suspected late onset invasive infection, the incidence of necrotizing enterocolitis, the time taken to reach full milk feeds, and that means 150 mils per kilo per day, sustained for 3 days. Also growth, the duration of the parenteral feeding before they are discharged from hospital, the length of time in intensive care and the overall length of hospital stay. The trial is going to take place across the United Kingdom and Ireland, and we're aiming to recruit 2,500 babies from around 50 units during a 3-year time frame. To take part in the SIFT trial, the babies need to be of less than 32 weeks gestation or less than 1,500 grams. They also have to be on less than 30 mils per kilo per day of milk at the time of randomisation, and of course we need written informed parental consent. Babies who we would prefer not to be included in the SIFT trial are those with severe congenital anomalies, and that would need to be decided by a clinician, those that don't have any realistic chance of survival, and also those that are unlikely to be traceable for follow-up at 2 years of age. The SIFT website has plenty of information on there, including guidance sheets and things to help you work out any queries or questions that you've got. Most things are covered on there, but if not, then please do ring us at the SIFT Coordinating Centre.